This new campaign by pharmacists targeting the government's double reforms on dispensing. Let's bring in Anthony Tassone. He's Vice President of the Pharmacy Guild. Anthony, thanks for your time. For our viewers who might not be aware of the ins and outs of this proposal, what is the government imposing on pharmacists and what are you most concerned about with it?
Thanks, Kieran. What the government is looking to implement is that rather than getting 30 days supply of prescription medicines for chronic conditions, a list of 325 medicines, that you'll be able to get 60 days at a time, and you'll be visiting your pharmacy half as much and potentially not visiting your doctor as often if you get a longer prescription length. And on the surface, this looks good for patients and consumers. You're getting twice as much medication for half the price, 2 for 1. But what people might not understand or realise is that this measure is actually being funded by 6,000 local community pharmacies and small businesses across Australia. The Australian government is shouting the bar, but wants the bar to pay for it. And what they're essentially doing is wanting the publican to pick up the tab. And over time, what the consequence will be is you'll have to lay off staff and eventually the bar closes. What that means for community pharmacies, as highlighted in a recent independent report from Henry Ergas, esteemed economist, and Tulipwood Economics and Griffith University, that this measure, if taken forward as announced, could lead to over 20,000 job losses nationwide and over 650 pharmacy closures. Pharmacies and pharmacists want cheaper medicines for our patients. It's a good thing for access to healthcare, but not at this cost to the health system in terms of pharmacy closures and job losses.
Some of our viewers who might be among those with chronic conditions, who might like the idea of getting 60 days worth of supply of their medication, it would sound appealing to a lot of people, wouldn't it?
In principle and on the surface, it does sound good for patients, and there is a way that we can deliver cheaper medicines for patients without wreaking havoc on the sustainability of the community pharmacy network. Community pharmacies are the most visited and accessible primary healthcare destination in Australia. What we want at the Pharmacy Guild and pharmacies across Australia is to sit down with the federal government and work out a new funding agreement going forward that, should this measure come into place, that there is a new funding agreement for community pharmacies that won't lead to job losses and pharmacy closures and an end to free services that pharmacies currently provide patients and they've come to rely on. Things such as home deliveries, particularly for older and vulnerable Australians. You have pensioners who are going to reach their safety net anyway, even with 60-day dispensing, albeit later in the year, and they don't financially benefit from the 60-day dispensing policy, but they may actually have to pay more for their services from the pharmacy, whether it's home deliveries or whether it's dose administration aid and Webster packing. So you have older, more vulnerable Australians paying more for their services and cross-subsidising the convenience for healthier, wealthier Australians. That's a perverse outcome. Now, we can avoid this. We can mitigate this if we sit down with the Australian Labor government and work through how we have a new funding agreement of delivering cheaper medicines in a responsible and sustainable way. But what's happened is they haven't done their homework. They've rushed the announcement of this policy. They've admitted that there's modelling being done after the policy announcement. And here we are scrambling to figure out whether this can be done in a way that doesn't cost jobs and pharmacy closures heading towards September 1. And the job losses will disproportionately affect rural and remote communities.
I've just got a statement here.
Sorry,
I want to put it to you from Mark Butler's office, the Health Minister. He says, this is from his office, this is the latest scare campaign from the pharmacy lobby group about the government's cheaper medicines policy. Every single dollar saved by the government will go back into pharmacy services. So pharmacists can play an even more central role in the healthcare of Australians. What do you say to that?
This is not a scare campaign, but pharmacies and pharmacists across Australia are scared about the potential impacts for patients and patient access to their pharmacy. This notion of every dollar saved by government being reinvested in community pharmacies, it's a furphy. It's not true. It's basically shifting who is paying for a service from the pharmacy. It's shifting it from the patient to the federal government. So things like the opioid dependence treatment program, provision of methadone and buprenorphine, and the administration of vaccines under the National Immunisation Program are currently being paid for by patients through their community pharmacy. Under this policy measure, that will be picked up by the federal government, which is a good thing for patients. But what the federal government is actually paying is less than what the pharmacy currently receives from patients. So it's really a cut on a cut. It's not reinvestment. We are made to feel like our vital organs are being ripped out, and they're giving us a facelift and want us to thank them for it. This is not good policy the way it's been taken forward. There hasn't been consultation
when you ask
with the
for
community pharmacy
talks,
sector.
And you want to have talks with the minister and the government, what is going to be your message? So if you want to have 60-day dispensing, you've got to provide some sort of support, some sort of funding for pharmacies in order to help compensate. Is that the sort of thing you're looking at?
Yeah, absolutely, Kieran. We're in the middle of the 7th Community Pharmacy Agreement. These are 5-yearly agreements that the Pharmacy Guild reaches with the Commonwealth Government to help deliver and distribute PBS medicines across Australia. We're halfway through the 7th one. And this 60-day policy that's been rushed and not consulted on has essentially torn up that agreement. We need a new funding agreement with the government, and we want to sit down with them and work through the detail of a new funding agreement that can come into place with the commencement of 60-day dispensing if it's to go ahead, so that we don't wreak havoc on the network and we don't have job losses and pharmacy closures and reduced trading hours and an end to pharmacy services. So we do have an existing funding agreement being the 7th Community Pharmacy Agreement. Yep.
This advertising campaign in 8 marginal seats. Is this the Guild saying, here's a shot across the bow, there'll be more to come if the government doesn't compromise? Because you're starting with 8 seats, 8 of the most marginal. Is the Guild willing to go further than that?
We don't rule out any option advocating on behalf of our patients and our pharmacies delivering their care. This is a national campaign that we are running, Save Your Local Pharmacy, and you can find out more at saveyourlocalpharmacy.com.au. And those 8 marginal seats have a particular focus, and we do want as much engagement as we can have with MPs with their local pharmacies, because they have an important message to share with their MP about the potential impacts and the very real concerns they have of what this means. So this is a national campaign. Yes, we are placing attention on those 8 seats, and we won't rule out going further if we have to. But we don't want to be here doing this. We want to be at the table with the government, working on a solution together of how we can deliver cheaper medicines in a responsible and sustainable way that doesn't compromise the network, jobs and pharmacy closures.
Anthony Tassone, Vice President of the Pharmacy Guild, appreciate it. I'll talk to you soon.
Thank you, Kieran.